Hiya, my name is Joe and I'm a district nurse. I've been a district nurse since 1997, and even though I do moan sometimes about my job, I do actually love it. I've been asked to talk to you about the neighbourhood nursing service. We work together with other services to support the most unwell and vulnerable people in Barnsley, and that includes people in care homes. Now, until recently, we didn't really have much to do with people in care homes. It was just mainly supporting people at home. The thinking was, if people were paying extra money for nursing care, then the nursing home should really be providing that. And the old objectives spoke mainly about looking after people at home and didn't really mention care homes. 2016, I think it was, we were told the service was going to be changing. So we work in the NHS. You think we'd be used to changes by now. If your service isn't reviewed and changed at least every 2 years, you're really working for an NHS service. So the new model of working brought a lot of changes, not least getting used to this new name, Neighbourhood Nursing Service. But joking aside, it does pretty accurately describe the way that we work now. So we work to 6 neighbourhoods. We're responsible for care homes and GP practices within our own assigned neighbourhood. And we do actually see a lot more of the GPs now than we used to. We also do, and wait for this, agile working, which means hot desking and using technology. I've got to be honest here, I was sceptical about all of this. All I could see was a lot of extra work, and what I couldn't see was how any of this was going to benefit the patients. There's a lot of added responsibility that, let's face it, should be the community matron's work. We can't prescribe, so we'd still be contacting doctors. I was miffed and anxious. But you think, come on Joe, crack on with it. Let's just see what happens. And this is where I eat my words, because it has got better. Don't get me wrong, it hasn't all got better. There's still room for improvement within the service, especially with the technology, and there's other stuff. But as far as the patients are concerned, things have improved. I've got an example. So there was a lady in a nursing bed in one of my care homes. She had dementia, COPD, lung cancer, and this has spread to her spine. She was in a pretty poor way, bless her. And she'd been in this nursing home for 6 months, so they knew her quite well, and they were great. They were really up for learning how to look after her, so when her time came, eventually, this lady would be able to die in what had now become her home. The lady had a urinary catheter fitted, and I gave them some training around that. The Macmillan nurse gave them some training on end-of-life care, like pain relief, that sort of thing. Now, this lady became very confused. The family were upset, I knew they were getting distressed at visiting time, and the family were asking for this lady to be admitted into hospital, but the care home didn't want that. See, after the training, they realised that this was probably urinary tract infection. The old lady's urine was cloudy and it was quite smelly, and now they realised that this could cause this type of confusion. So the family wanted a GP contacted. That's understandable, of course it is. I'd probably want a GP if my mum was in that situation. So that's what the care home did. They contacted the GP, but they also contacted the community matron, because the matron knew this lady. The matron got hold of me. She agreed it probably was a urine infection, so she prescribed a very small dose of midazolam, just to calm her down a little bit. And I dipstick tested her urine, and that found blood and nitrates. So I took a sample to send to the laboratory. I shared my findings with them, community matron and the GP. GP prescribes antibiotics that the care home now give to the lady. Thing is, I had to talk to the family, and I had to convince them that it was in the lady's best interest to take care of her here in the care home. And it took a while, but they came round. They were okay with it. I stayed in touch with the care home, made sure everything was okay, made sure they were doing everything correctly, encouraging fluids, ensuring that the lady was taking this medication. And after 2 days, she started to improve. She was less agitated, less confused, and the urine cleared. 4 months on, sadly, this lady's time came and she died. Our service had support in place. The Macmillan nurse was there supporting. And this lady had a very peaceful death, surrounded by all of her family. Now that's got to be better than dying on a busy hospital ward.